Google just got caught serving up dangerous medical misinformation through its AI overviews. People searching for liver test results were getting completely false information that could make seriously ill patients think they're healthy. Experts called it dangerous and alarming. Google quietly removed some summaries after getting exposed, but the problem goes way deeper than a few bad search results. AI is citing YouTube garbage as medical fact. Have you ever trusted Google's AI health information, or do you always verify with real doctors? Tell us below. Google's AI Overviews feature just got exposed for providing dangerous medical misinformation that could literally harm people's health. The Guardian ran an investigation and discovered that when users searched for basic health information, like what is the normal range for liver blood tests, Google's AI was serving up completely inaccurate information that experts described as potentially life-threatening. Here's what happened. Google's AI Overviews, which use generative AI to provide snapshots of information at the top of search results, were giving people bogus information about crucial liver function tests. The AI would spit out masses of numbers with little context and no accounting for nationality, sex, ethnicity, or age of patients. What Google's AI said was normal could vary drastically from what was actually considered normal by medical professionals. The truly scary part is that this misinformation could lead seriously ill patients to wrongly think they had normal test results and skip follow-up healthcare appointments. Someone with actual liver disease could look at Google's AI summary, see numbers that the AI claimed were normal, and decide they didn't need to see a doctor. That's not just misleading, that's potentially deadly. After the Guardian's investigation went public, Google quietly removed the AI overviews for the search terms, "What is the normal range for liver blood tests?" and "What is the normal range for liver function tests?" Notice how Google didn't proactively catch this problem themselves. They only acted after getting publicly called out by journalists. That should tell you everything about their quality control process. A Google spokesperson gave the standard corporate non-response. "We do not comment on individual removals within search. In cases where AI overviews miss some context, we work to make broad improvements, and we also take action under our policies where appropriate." Translation: we got caught, we're not admitting fault, and will use vague language about improvements without specifying what those improvements actually are. Vanessa Hevdich, Director of Communications and Policy at the British Liver Trust, initially praised the removal, but then pointed out the obvious problem. If you ask the question slightly differently, like typing LFT reference range or LFT test reference range, Google's AI overviews still pop up with potentially misleading information. So Google didn't actually fix the problem. They just removed the most obvious examples that journalists specifically highlighted. Hevdich explained why this is so dangerous. A liver function test, or LFT, is a collection of different blood tests. Understanding the results and what to do next is complex and involves a lot more than comparing a set of numbers. But the AI overviews present a list of tests in bold, making it very easy for readers to miss that these numbers might not even be the right ones for their test. Even worse, the AI overviews fail to warn that someone can get normal results for these tests when they actually have serious liver disease and need further medical care. That's false reassurance that could be genuinely harmful. Someone could see normal results from Google's AI, decide they're fine, and miss critical early treatment for a serious condition. Google has a 91% share of the global search engine market. When they screw up health information, it affects billions of people worldwide. And this isn't an isolated incident. The Guardian found multiple other examples of Google's AI providing completely wrong and potentially dangerous information about cancer and mental health. Google hasn't removed those AI overviews, claiming they link to reputable sources and inform people when to seek expert advice. Here's where it gets even more ridiculous. Google claims they have an internal team of clinicians who reviewed the examples and found that, in many instances, the information was not inaccurate and was also supported by high-quality websites. Notice the weasel words. "In many instances" means not all instances. Not inaccurate is a double negative that avoids saying accurate. And supported by high-quality websites doesn't mean the AI interpretation of that information was correct.
The Hacker News discussion about this story revealed an even deeper problem with Google's AI. Users reported that Google's Gemini AI frequently cites AI-generated YouTube videos as its primary source for information. Let that sink in. Google's AI is using other AI-generated content as authoritative sources, creating a closed loop loop of garbage information, reinforcing itself. One heavy Gemini user described asking questions about Russia's industrial base and military manufacturing capability. The AI wrote a convincing response, but the embedded video source at the end was AI generated. The user's trust in Gemini's response went down immediately after noticing the AI generated source. That's the problem with these systems. They sound confident and authoritative, even when their sources are complete nonsense. YouTube channels with AI generated videos have absolutely exploded in quantity. Some users estimate that the majority of new channels and videos uploaded to YouTube might actually be AI generated now. This feeds into the dead internet theory, the idea that most online content is now created by bots rather than humans. And Google's AI is happily citing these bot-generated videos as authoritative sources for medical information. The barrier to entry for creating AI slop content has dropped to basically zero. Anyone can generate a convincing sounding video with AI voiceover, AI generated images, and completely fabricated information. These videos can accumulate a few hundred views, get picked up by Google's AI as a source, and then get presented to millions of people as legitimate medical information. One particularly egregious example involved fake Richard Feynman videos. Someone created a channel purporting to upload videos of the famous physicist explaining concepts, but the voice and scripts were completely AI-generated fakes. The disclosure was buried in small print in the description. The person who discovered it was only tipped off by the flat affection in the voice, which lacked Feynman's underlying joy. That's the level of deception we're dealing with. Google's response to all of this has been pathetically inadequate. They claim AI overviews only show up on queries where they have high confidence in the quality of responses. But clearly, their confidence is misplaced if they're serving up dangerous medical misinformation. They say they constantly measure and review the quality of summaries across different categories, but those reviews apparently didn't catch the liver test problem until journalists exposed it publicly. Sue Farrington, chair of the Patient Information Forum, said the removal of the liver test summaries was a good result, but it is only the very first step in what is needed to maintain trust in Google's health-related search results. There are still too many examples out there of Google AI overviews giving people inaccurate health information. Millions of adults worldwide already struggle to access trusted health information. Google's AI making that problem worse by confidently presenting false information as fact is genuinely harmful, and the company's financial incentives are completely misaligned with user safety. If AI-generated videos generate more engagement and ad revenue, Google profits regardless of whether the information is accurate or dangerous. The fundamental problem is that large language models like Google's AI don't actually understand the information they're presenting. They're pattern matching machines that generate plausible sounding text based on statistical relationships in their training data. When that training data includes garbage AI-generated videos from YouTube, the output is garbage, dressed up in confident-sounding language. Google wants users to believe their AI is a reliable source of information. They position AI overviews as helpful and reliable shortcuts to answers. But the reality is that these systems regularly hallucinate, cite dubious sources, and present false information with complete confidence. That's not a bug. That's a fundamental limitation of how these systems work. The medical misinformation problem is particularly dangerous because health decisions have real-world consequences. If Google's AI tells you the wrong normal range for a liver test, and you decide you don't need to follow up with a doctor because your numbers look fine, you could miss critical early treatment for liver disease. That's not a minor inconvenience. That could literally kill you. Victor Tangerman, senior editor at technology website Futurism, said the Guardian investigation showed Google has work to do to ensure that its AI tool isn't dispensing dangerous health misinformation. That's an understatement. Google needs to completely rethink whether they should be using AI for health information at all if they can't guarantee accuracy.
Matt Southern, writing for Search Engine Journal, pointed out that AI overviews appear above ranked results. When the topic is health, errors carry more weight. That's exactly right. Google isn't just including AI summaries as one option among many, they're positioning them at the top of search results as the definitive answer. When that answer is wrong about health information, consequences are severe. The irony is that Google could simply not show AI overviews for medical queries. They could recognize that health information requires accuracy that their AI can't reliably provide and stick to linking actual medical sources like Mayo Clinic, NHS, or peer-reviewed research. But that would require admitting their AI has limitations, which apparently isn't acceptable from a marketing perspective. What makes this even more frustrating is that there are actual high-quality medical resources online, reputable health organizations, medical journals, government
government health agencies, and established medical websites provide accurate, evidence-based health information. Google's AI is actively making it harder to find that good information by burying it under AI-generated summaries that cite YouTube garbage. The dead internet theory aspect of this is genuinely dystopian. We're approaching a point where AI-generated content on YouTube gets cited by Google's AI as authoritative sources, which then generates more AI content that cites the original AI content, creating an infinite loop of synthetic information that becomes progressively more detached from reality. And Google profits from all of it through ad revenue. Users on Hacker News pointed out that every single large language model suffers from similar problems. This isn't unique to Google. ChatGPT, Claude, Gemini, and every other LLM on the market will confidently present false information if their training data or retrieval sources are garbage. The difference is that Google has 91% market share for search and is positioning their AI as the first thing people see when looking for health information. The comparison to keyboards that mistype 40% of the time is apt. If a tool is unreliable, you don't use it for critical tasks, but Google is pushing their unreliable AI for exactly those critical tasks, like understanding medical test results. That's corporate irresponsibility disguised as innovation. Google's AI cited YouTube garbage as medical fact, gave dangerous misinformation about liver tests, and only fixed it after journalists exposed them. If you think Google should remove AI overviews from health searches entirely, smash that like button. If you've personally encountered bad medical info from AI, hit subscribe and share your story in the comments. Either way, verify everything with real doctors.